Welcome back to the WHHI News. We are going to talk about type 1 diabetes, how prevalent it is, how important it is to get tested. Joining me to talk about that, we have via Zoom Dr. Desmond Schatz. He's the professor and medical director of the Diabetes Institute within the CTSI at the University of Florida, Gainesville, and also Dr. Anastasia Albanese-O'Neill, JDRF International. Type 1 diabetes, how prevalent is it?
So that's a great question. Type 1 diabetes is a less common form of diabetes in the United States. There are approaching 2 million people living with the condition here in the US and about 9 million worldwide. So while it's less common than its sister diagnosis, type 2 diabetes, it still affects many Americans right now as we speak.
Now, let me ask you this. Can people be out there, adults or young people, that have this and they don't know?
Yeah, so that's a great question. We used to call type 1 diabetes juvenile diabetes, and that's because it was most commonly diagnosed in childhood, or that's what we thought. The truth is, autoimmune diabetes, the type where your body's immune system attacks and destroys the insulin-producing cells, and you have to replace that hormone with injections, so it affects children and adults, and often people don't have a family history, so they're not anticipating it. What's really exciting and why we're here today is now, thanks to decades of research, we have a simple blood test where we can detect type 1 diabetes in the early stages by identifying that autoimmune process before they have high blood sugars, and this gives us the opportunity to intervene.
Well, that's great news, because I know with blood work, a lot of times you will get the numbers on how high your blood sugar is. Dr. Schatz, do you recommend now that people, when they go see their physicians, say, I would like this newer test to see if I have diabetes?
Quite a significant number of adults with type 2 diabetes are mistakenly diagnosed, that probably about 5% of them actually have type 1 diabetes. So by doing a blood test, particularly in those who are not classical for type 2 diabetes, using a blood test which screens for these antibodies, islet autoantibodies, can help make the diagnosis correctly. We do know that we can identify the disease many years before the appearance of the disease. And by doing a blood test, again, these islet autoantibodies in family members, because we know that family members have a much higher risk of developing diabetes, that really 1 in 20 family members will subsequently develop type 1 diabetes. And that gives an opportunity for us to prevent the onset or the acute onset of the disease, hospitalizations, to receive potential therapy and enroll in clinical trials and research to understand more about the disease.
Are there specific symptoms, though, with type 1 diabetes that would be recognizable, or is it sometimes masked?
Well, so there's a couple things to think about. Now that we have the ability to test for these autoantibodies that Dr. Schatz mentioned, if we detect people in the very earliest stages, stage 1 or stage 2, they won't have symptoms. That's because a lot of the insulin-producing cells in their body are still working well enough to keep blood sugar levels close to target. Once enough of those cells are destroyed, that's when we start to see those symptoms, like thirst, like frequent urination, like weight loss and blurred vision. People can be very, very hungry because they can't convert their blood sugar into energy. And so we want people to be aware of those symptoms so they don't need to be hospitalized at diagnosis. But more importantly, we want people to screen so we can detect those things, we can detect those autoantibodies early in those early stages so that we can prevent hospitalization. We can give people time to prepare, and we can engage them in research so we can, again, ultimately delay, prevent, and cure type 1 diabetes.
Well, that is great information that we'll be passing along to our audience. And I want to thank you both for joining us here today on the WHHI News.
Thank you very much.
Thanks for letting us join you today.
And we will be right back with much more right here on the WHHI News. Stay there.